What are the different types of therapy? Because different psychologists will have a different therapy approach as well, won't they? Like we've spoken a little bit about CBT on the podcast before. Is that your main approach, and how is that different to some of the others?
Yes, at its heart, CBT is my main approach, and CBT, or cognitive behavioural therapy, means that you look to impact on people's thinking patterns or cognitions and their personal experiences and habits to help alter their feelings and behaviour. So in other words, when people come and see a psychologist because they feel bad, because they're depressed or anxious, a CBT therapist looks to pick up on the attitudes and patterns of thinking behind that, including negative thoughts, feelings of helplessness for depression, perception of danger and threat for anxiety, and look at particular ways that might influence those thinking patterns based on personal experience, sometimes even setting up homework exercises or activities or things that people can do to test those underlying beliefs. But whereas I say I'm mainly a CBT therapist, which many clinical psychologists are in Australia, so clinical psychology is the specialty which focuses very particularly on mental health difficulties like anxiety, depression, trauma reactions, and most clinical psychologists in Australia were trained in CBT. But for my formal training, I chose a psychodynamic stream, which is a prominent stream, say, in Europe and also historically following on from Freud. Also, Jung was another psychodynamic practitioner, and so people would know my interest in synchronicity. I have an interest in Carl Jung as well, where you also look at the interpretation of dreams or imagery. So actually, myself, like many other therapists, will often look beyond just the main approach that you were trained in and look to integrate or incorporate other things. For example, there's also Gestalt therapy, which might focus on feelings in certain ways and even incorporate some psychodrama or two-chair work where someone might act out two different parts of themselves by sitting in one chair and engaging in a conversation with another part of themselves, so to speak. But those methods also, to some extent, are incorporated these days within CBT because different parts of each of these fields influences the other. There's also family therapy, and it will tend to be social workers who've had a greater emphasis in their training in that area, but also quite a number of psychiatrists and psychologists might have specialised in that area as well. Another field is called interpersonal therapy, where particularly you're looking at relationships between people. And so I'd say also counselling psychologists, another specialty of psychology, they'll often be exposed to a range of these therapy approaches, and individual counselling psychologists might have one favoured approach relative to another. And then the other specialties would include sports psychology or organisational psychology, where they might draw on various types of these approaches. But whether people might be a psychiatrist, a psychologist, a social worker, they're choices that people make through their career about which types of therapy approaches, CBT, psychodynamic, family, that might suit them further. And people often specialise further in one particular area, but sometimes adding on understanding from other areas to look to blend or round out one's strategy, so to speak.